All right, thank you, Ben. And joining us now, we have Dr. Samir Gupta, and he is the medical director for Vein Clinic PA. Dr. Gupta, thanks so much for joining us on our morning show.
Thanks for having me.
So you're here to talk about varicose veins. Now, I know people who suffer from varicose veins know what they are, but for those who don't know, can you tell us about that condition?
Samantha, varicose comes from the Latin varix, meaning something that's twisty and bulging.
Okay.
These are veins that are very large in size. A lot of times these veins are below the skin surface and people don't see them. But when these veins are closer to the skin surface, people see them, and that's why there's an association that if you see some large bulging veins, you have varicose veins, otherwise you may not have those. Regardless whether they are on the skin surface or below the skin surface, they are diseased veins that result in poor circulation, so you will have symptoms. Symptoms initially will be heaviness, aching, tiredness, itching, burning, cramping, restlessness. And if we do not treat this condition in time, there are complications such as frequent skin infections, blood clots, bleeding, sores that heal poorly.
Now, it sounds like a very uncomfortable condition to have.
Over 50% of adults suffer from vein problems. They may or may not even be aware that they have this condition.
Okay, so when they see signs like that or have symptoms like that, what are their options? I understand that there's a new laser procedure that you guys offer. Can you talk about that?
True. Samantha, in old days, you may have heard of stripping, which was essentially there are some leaky, diseased pipes or veins in the legs that are not functioning. You surgically take them out. There was downtime, complications, and over 50% of our patients have already had the vein stripping in the past, and they come back with symptoms.
Okay.
Now, with the new technology and our understanding of vein problems, things have changed. Now what we do is, in an office setting, we numb the area. Locally, people are reading a magazine during that process. And we thread a tiny laser fiber right to the source of the problem veins, and the laser energy shuts the vein down from inside. Then we put some dressing and people can go shopping.
So and the healing process is very, very quick.
It is extremely easy. In fact, people go right back to work. They can, go and resume their activities, exercises right away.
I've heard this is called the lunch break surgery because it's so quick. You can almost go during your lunch break and get treated for your veins. Now, you recently opened a clinic in Duluth. What prompted you to do so?
It's very interesting. We had opened a site in Blaine in the Twin Cities area, and one of our patients, he wanted us to open a site in Brainerd because his family and his friends needed care there, and he got tired of us not opening a site quick enough, so he started bringing pictures of office spaces in Brainerd.
Oh, wow.
So we got an office in Brainerd, and then there were patients coming from Duluth, and there was one patient, she said, I know this perfect spot just in case you decide to come to Duluth. It's right across from the mall, and there's this perfect building that would be, ideal place for you. And so we made Duluth happen. And the day we opened our doors, we had 6 or 7 patients walk in.
That is fantastic. And once again, if you have a problem with problems with your veins, make sure to call the Vein Clinic PA at the number you see on your screen, and that's the number to schedule appointments?
Yes, and these are procedures covered by insurance. We have extended hours. The 800 number you can call anytime during the day.
Okay, wonderful. And of course, we'll have all of this information on our website as well. Dr. Gupta, thank you so much for joining us. And still to come on Good